Welcome back to Dove Series. This is the second part of our July Uterine Fibroid Awareness Month series. If you haven't watched part 1 yet, that's where we cover what fibroids are, how common they are in Nigeria and across Africa, and how they are diagnosed. This video picks up from that foundation. Here, we're getting into symptoms, what they actually feel like, why so many women miss them, and what you can do to protect your health and your quality of life. Fibroids don't always announce themselves clearly. If you've been soaking through pads every hour on the heaviest days of your period, if your stomach feels heavy and full even when you haven't eaten, if you've been anemic for years and no one's explained why, this video might answer some questions you might have. And in our culture, a lot of what they cause gets filed under that's just how periods are. It isn't. Why do fibroid symptoms get missed? Here's something that doesn't get said enough. Fibroids are often silent. Roughly 7% of women with fibroids have no symptoms at all. Their fibroids are found incidentally during a scan or something else. But even among women who do have symptoms, many don't connect those symptoms to fibroids, or they just suspect something is wrong and they have no idea what it is. This is especially true in Nigeria, where research consistently shows that women present late, often years into having symptoms. A study published in 2025 from University College Hospital Ibadan found a significant number of women with symptomatic fibroids in urban Nigeria waited years before seeking care. Another study documented an average of over 38 months, more than 3 years, between the start of symptoms and the first hospital visit. Part of this is fear of surgery, part of it is cost, but a big part is simply not knowing. Heavy periods get normalized, abdominal fullness gets put down to weight gain, fatigue gets blamed on stress, on life, on Nigerian women are strong, and fibroids grow quietly in the background. So let's go through what to actually watch out for. The symptoms are heavy menstrual bleeding, which we call menorrhagia. This is the most common symptom and the one that causes the most downstream damage. We're not talking about periods that are slightly heavier than average. We're talking about flooding, that is, soaking through pads or tampons within an hour or less, passing large clots, bleeding for more than 7 days, or needing to wake up at night to change your protection. Submucosal fibroids, those are fibroids that grow within the uterine cavity, are the worst offenders here. A lot of women have been bleeding like this for so long, they generally don't know it's not normal. It is not normal, and that level of blood loss, sustained over months and years, leads directly to our next symptom, which is anemia and fatigue. Iron deficiency anemia from fiber-related blood loss is one of the most common complications. We see this in Nigerian men with fibroids all the time. The fatigue is not ordinary. Tiredness is not ordinary. It is bone-deep exhaustion, the struggling to climb stairs, difficulty concentrating, heart palpitations, dizziness on standing. Some men have hemoglobin levels so low that by the time they present, they need transfusion before any surgical intervention is even possible. If you've been told repeatedly that you're anemic and you take iron for a while and it improves and then it comes back, that cycle should prompt investigation. The iron is not the problem. The blood loss is. Another symptom is pelvic pain and pressure. Fibroids can cause a constant dull ache and heaviness in the lower abdomen and pelvis. This is different from menstrual cramps. It can be present even outside your period. Large fibroids create mechanical pressure on the surrounding structures, which explains several other symptoms that might not seem obviously connected to the uterus. Another symptom might be urinary symptoms, like a fibroid present on the bladder, which can cause frequency, that is the urge to urinate almost constantly, even when your bladder isn't full. In some cases, it causes difficulty emptying the bladder completely. In others, there's urgency, that is, the sudden pressing need to go to the toilet. Symptoms are often mistaken for urinary tract infection, but when a urine culture is done, it comes out clear and symptoms persist. Fibroids should be on the list of possibilities in such situations. You may also experience back pain and leg pain if the fibroids press on the nerves on the spine and can cause these symptoms, occasionally referring to pain down the leg. This is more common with large subserosal fibroids, the ones growing on the outer surface of the uterus. Abdominal swelling may also occur. This is actually the most common presentation in Nigerian clinical data. Women come with a visibly enlarged abdomen, and in some cases, they've attributed it to weight gain or bloating for a long time. The fibroid uterus can reach the size of a second trimester pregnancy before a woman seeks care. One Nigerian study found that abdominal swelling was reported in over 62% of fibroid cases at presentation. Painful periods also happen. This we call dysmenorrhea. Heavy bleeding and pain go together. Submucosal fibroids cause severe cramping as uterus contracts, trying to expel the blood clots. If your period pain is getting progressively worse over time, and medication that used to help no longer does, that's worth investigating. Fertility and pregnancy concerns may also occur. Depending on their location and size, fibroids can interfere with conception, implantation, or pregnancy outcome. Submucosal fibroids are most likely to affect fertility as they distort the uterine cavity where a pregnancy will implant. Large intramural fibroids can also have an effect. Not all fibroids cause fertility problems, and many women who have fibroids conceive and carry pregnancies to term without complications. But if you've been trying to conceive and the process is taking longer than expected, fibroids should be part of the conversation. Now, how will you manage symptoms and protect the quality of your life? Being diagnosed with fibroids is not the end of the conversation. It's the beginning of it. Here is what protecting the quality of your life actually looks like. Get the full picture first. Before any decisions are made, you need a proper ultrasound. Ideally, a transvaginal scan if possible, to know how many fibroids you have, their sizes, and their locations. Location matters more than size in many cases. A small submucosal fibroid can cause more trouble than a large subserosal one. Know your own situation before moving on to the management plan. 2. Address anemia actively. If you're losing significant blood every month, iron supplementation is part of the picture, but it has to be done properly. Ferrous sulfate on its own may not be sufficient in moderate to severe anemia. A full blood count, serum ferritin, and sometimes serum iron studies will tell your doctor how depleted you actually are. Dietary sources help, such as liver, dark leafy vegetables, beans, red meat in moderation, and vitamin C to improve absorption. When the stores are very depleted, supplements and sometimes IV iron are necessary. And if you're planning surgery, getting your hemoglobin levels up beforehand is not optional. Surgeons need you stable. Some women require iron infusions or even transfusion preoperatively. For the pain management, for fibroid-related pelvic pain and period cramp, NSAIDs, which are non-steroidal anti-inflammatory drugs like ibuprofen, are first line. They reduce pain and also have a modest effect on menstrual blood loss. Mefenamic acid is also another option. This works best when taken regularly during the heaviest days rather than only when pain becomes unbearable. Your doctor can also discuss hormonal options that may reduce bleeding. Now, you need to know your treatment options. This is critical because many women in Nigeria believe fibroid treatment means the removal of the womb, full stop. That is not true. Watchful waiting is legitimate for small fibroids that aren't causing any significant symptoms, particularly as you approach menopause, where fibroids tend to regress. Now, for medical management, we can use medications such as GnRx analog, tranexamic acid, or levonorgestrel IUD, which can reduce bleeding and shrink the fibroids. These are sometimes used as a bridge before surgery. A surgical option is myomectomy, which is removing the fibroids and preserving the uterus. It's the most common surgical approach in Nigeria, particularly for women who want to retain fertility. A thyroid review from a Nigerian tertiary hospital found that this is used in 86.5% of surgical cases. Hysterectomy, which is the removal of the uterus, is reserved for cases where fibroids are very numerous, symptoms are severe, and woman is done with childbearing. Uterine fibroid embolization, called UFE, is a minimally invasive procedure where blood supply to fibroids is cut off. It's available in some Nigerian centers and has shown good outcomes in African women. However, it's not widely accessible yet, but it's an option worth asking about. The right treatment depends on your age, your symptoms, your fibroid characteristics, and your reproductive goals. No one-size answer exists. Be wary of anyone who doesn't take all of these factors into consideration first. Fibroids affect more than the body. The chronic pain, the fear around fertility, the disruption to work and social life, the financial cost of treatments. These have a real emotional toll. It's vital to grieve the disruption fibroids cause in your life. It's also worth knowing that many women manage very well once they have the right diagnosis, the right information, and the right support. If fibroids are making you feel anxious, low, or overwhelmed, say that to your doctor. Your mental health is part of this picture. Fibroids are not something you should have to manage silently or normalize as the price of being a woman. You deserve answers, you deserve proper investigation, and you deserve a treatment plan that takes your whole life into account, not just your uterus in isolation. If anything in this video sounded familiar, symptoms you've been living with, questions you've been having known how to ask, please don't wait another 3 years. Book the appointment and get that scan. Come into Chem Health this month where we are offering a 15% discount on all transvaginal and transabdominal scans. Thank you.